Hello, I'm Dr. Petersen. Before you come in for your consultation for an abdominoplasty, or what's commonly known as a tummy tuck, I wanted to go over some things to expect about surgery and recovery so you can think about what questions to ask when you come in to see us. These things are the same whether you're just having a tummy tuck or whether you're coming in to combine a tummy tuck with a breast rejuvenation and what we commonly call a mommy makeover. Whatever you choose, I believe it's helpful to know a little bit more about what to expect from surgery. As you can guess, there will be swelling and maybe even some bruising with your procedure. That's normal, and it can take a full 6 months for all of your swelling to go away. Usually after surgery, it gets a little worse before it gets better, and so we don't want you to get discouraged as you wait for your final results. And there will be some pain after surgery as well. This is usually short-term, although there are very rare instances where long-term or chronic pain after tummy tuck surgery can occur. That long-term or chronic pain could come from a nerve injury during surgery. And nerve pain is a little bit different. It is experienced as a sharp, almost electrical zinging pain that travels along the nerve pathways. If you experience this kind of pain, there are special medications we can use to try and help quiet those nerves. After surgery, your abdominal area will feel numb for several months, and this is also normal. In fact, with the tummy tuck, you will have a small area of numbness in the lower abdomen, just above the pubic bone, that will stay permanently numb. Most women rarely notice this, and all my patients have felt that the trade-off of some numbness was worth the tummy tuck results. In my practice, all tummy tuck patients get Exparel during their surgery, which is a long-lasting numbing medication injected into the abdominal muscles, which I have found really helps control the initial post-surgical pain, making the whole process much more pleasant. In fact, you may need help remembering not to do too much too quickly. We do not want you doing any exercise or lifting over 5 to 10 pounds for 6 weeks after surgery. That will also help to prevent a post-surgical hematoma or extra bleeding after surgery. You may also know that everyone's body lacks perfect symmetry. Our faces aren't perfectly symmetric either. When we talk about breasts, we like to say sisters, not twins, and the same can be true of our abdomens. So although we'll do everything we can to get the best symmetry possible, there may be some asymmetries that persist after surgery. Any surgical procedure has a risk of infection. We give you antibiotics to help prevent this, and that's the only medication we give you that we want you to take all the way until it's gone. You'll have drains placed during the procedure, and we'll explain more about that during your consultation. But we want you to be taking antibiotics as long as you have drains in place. The reason we use drains is to help your body remove some of the fluid that it naturally produces as part of the healing process. If after the drains are removed, you get a residual buildup of fluid in your abdomen, we call that a seroma. We will want to see you in our office about 1 week after your drains are removed to check for a seroma. So plan on seeing us about 3 weeks from your surgery date, depending on when your drains are able to be removed. During a tummy tuck, I make an incision low across the abdomen, and during your consultation, I can show where that would likely be done on your body in particular. All surgery comes with scarring, and some people are prone to making poor scars. But for most patients, the scar will fade to a thin white line, although it can take a full year for that to fully happen. We want to make sure that you protect your scar from the sun and any UV damage during the first year, as that UV exposure will make the scar permanently darker. It is possible that the scar may have trouble healing in places, and an incision could separate a little bit, or there can be some areas where the skin might break down slightly. This is much more likely with smoking or vaping of any kind, so I'm very firm in my requirement that patients stop smoking before and after surgery for a minimum of 6 weeks. While I try and remove most, if not all, of the stretch marks women have below the belly button, I can't always remove them, and I can't remove any stretch marks that might exist above the belly button before surgery. Because we pull your abdominal skin tight as we redrape it over your abdominal area, it's even possible to get new stretch marks, although this is very rare. But this is one reason we want you to stay slightly hunched over for the first couple of weeks of the healing process to allow your body to adjust and heal. It's important to keep in mind that a tummy tuck is not a weight loss surgery. You'll probably see less change on the scale afterwards than you think. It won't prevent you from gaining more weight in the future either, and gaining more weight will affect your results. So stay healthy and take care of your body. Weight gain or even just aging can lead to some new skin stretching or sagging. Another thing that can have a dramatic effect on your tummy tuck results would be future pregnancies. I do not recommend you have this procedure if you plan on having any future pregnancies, because you will likely undo your surgical results. It is important to remember that doing multiple procedures together can increase all medical surgical risks. And one of the risks we monitor the most is the risk of blood clots or DVTs during and after surgery. There are several precautions that I take to minimize this risk, but the most important thing is that I want all of my patients up and walking after surgery. I do not want you to go home and lay in bed for a few days. You will need a responsible adult with you after surgery for at least 24 hours, and one of their jobs is to make sure you get up and walk every 1 to 2 hours, even overnight the first night. We want you to walk. I hope this educational information is helpful as you're considering your surgical procedure. During your consultation, we will take pictures and I will do a physical exam so that we can personalize our discussion specifically to your body and your goals. So come with your questions and let us guide you through this exciting transformation journey.